I want to tell you about the hair transplant. So basically there are two methods, strip method and FUE or follicular unit extraction method. We don't promote any other method called as DHI or anything else. So basically it is the two methods, and FUE is more prevalent these days. It is because of the patient demand, and also because these days we take the grafts from chest also and from the beard also, in which the strip method does not work, so it is only the FUE method. FUE method is very important if your extraction rate is very less. Suppose if you make 100 punches, so about 90 to 95 of your grafts should be healthy, and there should not be any cutout rate. So we usually promote FUE method at our clinic, which is much more in demand these days. So with the FUE method, so there are basically three steps in the hair transplant. There is extraction of the grafts, in which patient lies down prone and we take out the grafts. Second step is the slitting. The donor side, the recipient side is prepared with the slits. Slit is not a hole, it is like an opening in which we put the graft and the opening closes. That is called a slit, so that hair does not come out even after just 48 hours. Third step is implantation, in which the hair which is taken from the back, which is already stored in special holding solutions, or it is kept in a refrigerator, and we put it very fast in the slits which we have made. So basically there are three steps: extraction, slitting and implantation. So all these steps, it is always the doctor which is involved along with his trained team. Never think a hair transplant can be done by a single doctor. That is wrong. Don't even demand anywhere in the world. So it is the doctor and his trained team. So team should be very trained. The doctor is confident that my team is the best, only then he will allow them to work with them. And second thing is, it is a procedure which is done under local anesthesia. You are totally awake. There are no risks involved. There are no side effects. If you see the literature for the last 10 years in the internet, there is no any side effect or complications from the hair transplant. Only thing is, if the doctor's skills, hand skills are good, he can use the magnification, and he is trained in microsurgery, in that the handling of the grafts, which are very minute grafts, which is done under magnification, will be better. So I would like to highlight the points which are important. So during the extraction, if the doctor is trained, there will be very less damage or cutout rate. Even if he make 2000 holes or 2000 punches, he may get 1800 good grafts. But if the doctor is not trained to get 2000 grafts, he may make 3000 punches. So there is lot of wastage for your precious hair. We call them as diamonds, so don't lose your diamonds. And second important step is, while implantation, you have to gently handle them only once and put them into the hole or the slit which is created. If you hold your graft 2 times or 3 times with the instruments, the graft is dead. Even if you are implanting 3000 grafts, only 2000 will grow, because your handling is not by a trained person. So they are very delicate. Your grafts or hair are very delicate, so we don't want to damage them. And the third thing is about the density. The grafts can be put very far off. It can be very sparsely done. So when the result will come, you will come to know after 6 months or 8 months or 9 months. You will feel like, oh, the density is very less, then you will go for a second hair transplant. So my advice is always very aggressive. You can go for 4000 grafts. If you want from the beard also, you can increase 500 to 800 more grafts. So we can go for 4000, 5000 grafts even in 1 day, or even over the time of 2 days. It depends whether the grafts they come out easily. So there are 3 types of grafts. They can be thick grafts, thin grafts, or in between, medium grafts. So thin grafts, the result will be less and the time taken will be more. But if your own hair from the donor side, they are like thick, they are very good in quality, the result is better. You can achieve very good density and the time taken is less. And the last thing which is important is time for the surgery. how much time taken for the surgery is very important. It is always better to take the grafts and implant them within 3 hours. So golden time is 3 to 4 hours. So if the time taken is long, the survival rate of the grafts outside your body, the survival rate will be less. So there are many important points to be discussed. For that you can visit our website with the name of kyrahairtransplant.com, or you can call us. The phone numbers are available, and we always advise our clients to send us your pictures because most of them are international clients. So we always help them by seeing their pictures, so at least we have an idea what type of hairline will suit them, how many grafts will be required, and what will be the cost, and whether the donor site is sufficient or we may have to go for beard or body hair transplant. And second thing is, we also want to know the credentials of the patient, his name, age, place he belongs. So that is also very important for our record purpose. This is something which is permanent. You are not buying anything. You want something for your face or your head. So it is, the results are permanent. It is going to be your one hair transplant. If done nicely, the results will be better. So you should choose your doctor wisely. And I may tell you in another video how to choose your doctor. Thank you.